Hi, welcome to my YouTube channel. I'm Jenny Phillip Medicare. So today I want to talk about infertility in women. So what is infertility? Infertility is the inability of a woman to conceive after several uninterrupted sexual intercourse with her partner. Mark the word, uninterrupted sexual intercourse with her partner within a period of 1 year or after 1 year. Basically after 1 year. So you cannot term yourself infertile when you just got married and after 3 months or 4 months you now say you've not been able to conceive. No, mind you, some people's body differs. Some people's body, you at that point in time, maybe your body is trying to adapt to a new change. So some people get pregnant after 6 months, but once is completely 1 year of uninterrupted sexual intercourse and you are not pregnant, then you can now start looking at, oh, why am I not pregnant? You have to start coming to the hospital to check why you have not conceived. So there are things that can cause this infertility in a woman. Okay, so we equally have infertility in men, but that's not our topic for today. Today is infertility in women. So there are things that can cause this infertility in women. Number one, we'll talk about ovulation disorders. If you're having ovulation disorder, you don't even see your ovulation at all, it can cause infertility for you. Or maybe you're having ovulation insufficiency, your eggs are not sufficient enough to be able to receive sperm due to hormonal imbalance. Okay, so that can cause infertility in a woman. At this point, for you to be able to identify this, you must have gone to the hospital for them to run some investigations for you to be able to rule out that and tell you that you are infertile. So another thing that can cause this infertility in a woman is blockage to the fallopian tube. If the fallopian tube is blocked, you know that it prevents the sperm from meeting the fertilized egg and fertilizing it. So at that point in time, the woman is infertile. So what do? When you go to the hospital, they can do some procedures for you to free your fallopian tube to enable the sperm to go through. So there are things that can cause this blockage that can be handled. So such as like when you did not properly treat pelvic inflammatory diseases, PIDs, when they are not properly treated, they can occlude the fallopian tube, thereby preventing you from getting pregnant. So another thing that can cause this blockage is when there has been a surgery to the tube. Maybe you've had ectopic pregnancy previously, or maybe you've done some procedures and mistakenly they punctured your tube, or maybe something is blocking your tube. So at that point in time, it can cause infertility. Okay, so another thing that can cause this infertility in a woman is endometriosis, a condition we call endometriosis, that is fluid in the uterus. So when you have such a thing, it can cause infertility in a woman. Another thing that can cause infertility in a woman as well is when there are cervical or uterine causes, such as tumors. When you have tumors in your uterus, it can cause infertility. Mind you as well, fibroid can equally cause infertility in the woman. So another one is an unexplained causes. There are certain causes that you cannot even explain, it's just there. So we can now equally talk about birth abnormalities. They can equally cause infertility in a woman, which might not be identified until that woman has gotten to the age of childbearing, and then you find out that so you cannot be able to conceive. All these conditions can be handled when you come to the hospital. So when you go to the hospital, they will help you do some investigations, rule out these problems, rule out these conditions, and then solve it for you. So we have risk factors to infertility. Who are at risk? One, we talk about age. When a woman is approaching her mid-30s, the level of follicles begin to reduce. Then the eggs begin to decline. So at that point in time, it can affect her conceptual rates, so it can lead to infertility. Another one is smoking. When we tell our ladies stop smoking, they will say, no, it's my lifestyle, I love it. My dear, it's damaging a lot of things and can prevent you from conceiving when you need to conceive. Then we'll talk about alcohol. You take alcohol, you drink, you're challenging men. It's no good. Alcohol is no good. It can affect you and prevent you from getting pregnant. As a woman, you should not be taking too much alcohol. So another risk factor to this is sexually transmitted infections that were not properly treated. So when you have sexually transmitted infections, don't just go to a chemist and buy drugs by yourself and take. You need to go to the hospital so they will give you the right drugs to take at the right time, so that thing will not affect you later in future. Okay, so you need to treat your infection very well. Another risk factor to this infertility is stress. When you're stressing, you're overworking yourself, you're stressing yourself, you have to reduce stress. As a woman, stress can affect you and cause infertility for you. So another risk factor to this is obesity. Weight, you have to watch your weight as a woman. You don't need to be too obese. So obesity can cause infertility. So what are the preventions to this infertility? So to prevent, for women who wants to get pregnant in future or now, or who are anticipating getting pregnant, you have, number one, you have to eat a healthy diet. Make sure that you eat a healthy diet. Maintain your weight. Obesity and underweight is not good for a woman. It can cause infertility. Quit smoking if you are if that is your habit. You have to quit smoking. Tobacco has a very negative effect on the uterus and the body of a woman, organs of a woman. It can cause infertility. Quit alcohol intake. As a woman, you're not even supposed to be taking too much alcohol because it's not good for you. As a human being, you shouldn't be taking too much alcohol. It's not good for you. Another one, you have to reduce your stress. Most times you need to rest. You need to rest. Beautiful woman, you need to rest. Okay? Stress is not good for your body. Then you have to make sure that you're doing exercise once in a while. If not even once in a while, always try to do exercise and keep fit. It is very, very good for you. So try as much as possible to maintain all this. Then if the problem is birth abnormality, when you come to the hospital, the doctors can take care of you. We'll be able to diagnose you, find out the things that are causing this issue, and know how to help you. Thank you so much for listening to me. I still maintain Jenny Philop Medicare. If you have not subscribed to my YouTube channel, please run and subscribe. Go and subscribe to my channel, like my page, and comment. Bye.